Hi, my name is Dr. Roger Tsai, and I'm a board-certified plastic surgeon in Beverly Hills, California. Today we're making a video about breast lifts to go over the consultation process, provide some more information, the recovery, and expectations. So what exactly is a breast lift? First off, I like to break it down as volume versus skin. Some patients have volume issues, some patients have skin issues, some patients have both issues. So volume is treated with either an implant, an augmentation, or a reduction. When it comes to the skin, the only treatment is a breast lift. So oftentimes you can't place a big implant in order to provide a lift, and vice versa. One doesn't fix the other. Oftentimes if patients have a volume and a skin issue, they'll need a combination of a breast augmentation plus a breast lift. For those that are interested in the breast augmentation, I've created a video just specifically about that, so please reference that. But today this video is going to be concentrating more on a breast lift. So there are 3 different types of breast lift, and they're categorized depending on the scar pattern. We have what we call a donut lift, which goes just around the areola. We have a lollipop lift, which goes around the areola up and down. And we have what we call an anchor scar lift, which goes around the areola up and down and across on the bottom. Each individual patient, depending on their goals and expectations, will need a different type of lift. So the donut lift or a peri-areola lift is those that need a very minimal amount of lift. It's not a true lift because all it does is elevate the nipples about 2 centimeters at most higher, but it doesn't necessarily provide a breast lift. By making the nipples higher, it appears that the breast is lifted, but there's no true lift with this type of procedure. Most times with a donut lift requires an augmentation as well in order to help lift and elevate the breast for a fuller appearance. The lollipop lift is reserved for those patients who have moderate breast droopage, and the anchor scar lift is reserved for those patients who have more severe breast droopage. Between these 2 last types of lifts, I prefer the anchor scar lift because the breast is a 3-dimensional structure and you need 3 scars in order to treat each dimension. The first dimension is the areola and nipple to bring it to its proper position. Then you have the vertical component to help cone the breast and the horizontal component to help lift the breast. So I think all 3 are generally necessary in order to get the best results. Again, oftentimes an implant can be placed with these breast lifts in order to treat the volume aspects of the breast. This procedure is done under general anesthesia, which means the patients are fully asleep. Because of this, the effects of anesthesia oftentimes will linger for about 2 or 3 days. So I think of this as a lazy weekend, where patients are mostly at home, in bed or on the couch, but still up and moving around. Within a few days to a week at the most patients are back to their normal daily routine and activities, which means going back to work, running some errands outside of the house, and doing some chores inside of the house. However, I advise patients not to do any heavy lifting for about 4 to 6 weeks. After 4 to 6 weeks, I'll allow patients to start lifting more and getting back to all their strenuous activities. At 1 month, I'll also allow patients to start soaking in hot tub Polges and Kujis, and we'll start silicone scar cream to help the improvement of the scar and the appearance over time. Generally, it takes about 1 month for the breast to look somewhat presentable and up to 3 to 6 months for the final results. So this video goes over the general key points with a breast lift procedure. However, this is tweaked for each individual patient's goals and aspirations. Hope this was educational. If you have any questions, comment below or reach out to us for a consultation. Like and follow for more educational content.